Hi, welcome to my critical journey. My name is Char, and I am new to the ICU. I've encountered some things I've never seen before, so I made this channel to share what I've learned so that if you come across it, it won't be as foreign to you as it was to me. So this week, I had a 72-year-old female patient. She was admitted to the hospital for COVID pneumonia. And then she was transferred to the ICU because she got intubated for hypoxic respiratory failure. Throughout her hospital course, she developed abdominal pain and abdominal distension. They did some work upon her, which included a CAT scan and an x ray of her abdomen. And they diagnosed her with Ogilvie syndrome, also known as acute colonic pseudo obstruction, or ACPO. And what it is that her colon is massively dilated without the presence of obstruction. People who usually get this are severely ill or who recently had surgery. And if left untreated, it could lead to perforation associated with a high mortality rate. And perforation usually happens when the dilatation is greater than 14 centimeters in diameter. So when I took care of this patient, she was 11 cms dilated, and then they did a repeat exam the morning I took care of her, and it grew to 13 cms. She was on a high flow nasal cannula. She had a NG tube to low intermittent suction. She was NPO except meds, and she also had a rectal tube for decompression. She still had abdominal distension and right-sided tenderness, and she also haven't had a bowel movement for a couple of days. GI was also consulted and was on the case. Med-wise, we were given her just heparin sub-Q for her AFib and pyridostigmine or mestinon, 30 milligrams. Now, the mestinon is usually a treatment for people with myasthenia gravis, and my patient didn't have myasthenia gravis. But to understand what mestinon does, let's just do like a quick review of the autonomic nervous system, or the ANS, and it innervates the cardiac muscles, smooth muscles, and the glands. And it's divided into the sympathetic nervous system, or the SNS, or the fight or flight, and the parasympathetic nervous system, or the PNS, or the rest and digest. Now, the neurotransmitter acetylcholine is usually associated with the PNS, and for the SNS, it's the norepinephrine. Now, when you activate the SNS, your heart rate goes up, your blood pressure goes up, your airways dilate, glucose is released from your liver, but the digestive activities are inhibited because during the fight or flight, your body doesn't really need to worry about that. And for the PNS, it stimulates your digestive activities like digestion, defecation, urination. It also decreases your heart rate and decreases your blood pressure, and it constricts your airways. Now, the SNS and the PNS both have stimulatory and inhibitory effects depending on the target tissue they're working on. So, for example, with the sympathetic nervous system, if the target are the airways, then it dilates, but for blood vessels, it constricts. And then for PNS, if the target tissue is the bladder, it constricts or contracts to facilitate urination. And then for the heart, it inhibits heart contraction, so it lowers down the heart rate. So the autonomic nervous system is complex, and that was just like a quick overview. Now with the myasthenia gravis, what it is. It's an autoimmune disorder affecting acetylcholine receptors, and it leads to muscle weakness, muscle fatigue, and eventually to paralysis. And what pyridostigmine or mestinon does is it is a cholinesterase inhibitor. So it prevents the breakdown of acetylcholine. So they were giving this to my patient because they want to stimulate her bowels, but it wasn't really working. So they told me that GI gave them a go signal and that we were going to do a neostigmine challenge. Now, I gave my patient the 30 milligrams of mestinon in the morning, and then the doctor told me to do the neostigmine challenge around like 2 or 3 p.m. to make sure that the effects of the mestinon is gone. Just because they're similar medications, they don't want to double dose her. Um, so, neostigmine, it's the same. It works the same with the mestinon. So it's usually to treat myasthenia gravis, ileus, and glaucoma. And the order for the neostigmine was to give 2 milligrams per 2 ml over 15 minutes. So it was a very, very slow IV push. But before giving it, I had to take the rectal tube out. And the doctor said he ordered atropine 0.5 milligrams just in case the patient radies down too much. I told the doctor I've never done this before. Besides having the atropine ready at bedside, is there anything else I need to do? And he said get plenty of chucks ready, multiple bedpans, because it will bring on the waterworks. Now, our charge nurse knew that I was going to do the neostigmine challenge, and she was like, I've only seen this twice in my entire nursing career, and both times I've seen it, there was just a lot of poop involved. So be ready, make sure you're prepared. So I got everything ready. I took the rectal tube out, explained to the patient what we're doing, and like the side effects to expect. Number one was like abdominal cramping. And then one of the doctors said she'll stand outside the room just in case something happens, and then told me to cycle the blood pressures like every 2 minutes, because it can bring down the blood pressure. While I was giving it to her, her heart rate was like dipping occasionally to like the 40s and 50s, and then the doctor told me to give the atropine if it goes down to 30s or stays in the low 40s, but my patient didn't do that. Like, it was just an occasional drop. My charge nurse also was outside the room, and when she saw the heart rate drop, she just got the Zol and placed it outside the room just in case. So when I was injecting it, my patient also started like coughing slash gagging, and she had a lot of thin saliva coming out her mouth. So I had like the Yankauer ready, and like, I was suctioning her. But anyway, the neostigmine challenge was done, and she only put out a small amount of like loose, watery stool. So not what I expected. But she did complain of a 7 out of 10 abdominal pain after that. And her MAP did go down below 65 for like a minute, but it went back up. And I stayed with my patient for a couple more minutes after the challenge just to make sure like her blood pressure wasn't gonna drop again or her heart rate wasn't gonna drop. Well, thank you for watching. Feel free to leave any comments, stories, corrections below.